This medication is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, norethindrone, which is a progestin, and ethinyl estradiol, which is an estrogen. Additionally, there is a small amount of iron, ferrous fumarate, in each of the 7 inactive tablets taken during the 4th week. It's important to note that these inactive pills do not contain any hormones and are meant to keep you in the habit of taking 1 tablet each day. However, they do not have enough iron to treat iron deficiency. Aside from preventing pregnancy, this medication may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to remember that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, or chlamydia. As for the daily dosage, it is important to take 1 tablet each day at the same time to maintain its effectiveness. And as for the optimal timing, it is best to take the pill at the same time each day to help you remember and to minimize the risk of missed doses. Before you start using this medication, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Choose a time of day that is easy for you to remember and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. It's crucial to continue taking this medication exactly as prescribed by your doctor. Follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. Pregnancy is more likely if you miss pills, start a new pack late, or take your pill at a different time of the day than usual. If you experience vomiting or diarrhea, it may affect the effectiveness of the birth control pills. You may need to use a backup birth control method, such as condoms or spermicide. Consult with your doctor or pharmacist for more information. Taking this medication after your evening meal or at bedtime may help if you experience stomach upset or nausea. You may choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is important that you take this medication at the same time each day, 24 hours apart. Ask your doctor or pharmacist if you have any questions. Your pill pack contains 21 pills with active medication and 7 reminder pills with iron. Take 1 active pill, with hormones, once daily for 21 days in a row. Take 1 inactive pill, with iron, once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. You should have your period during the 4th week of the pack. After you have taken the last iron tablet in the pack, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If you are taking certain medications that can interact with iron, ask your doctor whether you should throw away the reminder pills, iron tablets, each day rather than taking them. Iron can decrease the effect of these medications. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist for information about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Norethin-Eth Estra-Ferrous FUM include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to talk to your doctor or pharmacist. This medication may raise your blood pressure, so it's important to monitor your blood pressure regularly. Be sure to tell your doctor if the results are high. It's also important to contact your doctor if you experience lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. Norethin-Eth Estra-Ferrous FUM may rarely cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath/rapid breathing, unusual headaches, unusual sweating, weakness on one side of the body, or vision problems/changes. In rare cases, a serious allergic reaction to this drug may occur. Seek medical help immediately if you notice symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. Remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects, but it's important to be aware of any potential concerns. If you are over 35 years old and smoke cigarettes or use tobacco, it is not safe to take Norethin-Eth Estra-Ferrous FUM. Smoking while using this medication can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure. It's important to avoid smoking or using tobacco while taking this medication. It's crucial to keep iron-containing products like Norethin-Eth Estra-Ferrous FUM out of reach of children, as accidental overdose can be fatal. If an overdose does occur, seek medical help immediately or contact a poison control center. Before taking Norethin-Eth Estra-Ferrous FUM, it's important to let your doctor or pharmacist know about any allergies you have to ethinyl estradiol, norethindrone, ferrous fumarate, or other estrogens, progestins, or iron products. This medication may also contain inactive ingredients that could cause allergic reactions or other problems, so be sure to talk to your pharmacist for more details. It's also crucial to discuss your medical history with your doctor or pharmacist before taking this medication, especially if you have a history of blood clots, high blood pressure, abnormal breast exams, cancer, high cholesterol or triglyceride levels, depression, diabetes, heart problems, kidney or liver disease, obesity, stroke, thyroid problems, or unexplained vaginal bleeding. If you have diabetes, this medication may affect your blood sugar, so be sure to check your blood sugar regularly and share the results with your doctor. If you are planning to have surgery or will be confined to a bed or chair for a long time, it's important to inform your doctor, as these conditions may increase your risk of getting blood clots while using hormonal birth control. It's also important to let your doctor or dentist know about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. Norethin-Eth Estra-Ferrous FUM may cause dark areas to appear on your face and skin, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may develop vision problems or have trouble wearing your contact lenses, so be sure to contact your eye doctor if these problems occur. It's also important to know that it may take longer for you to become pregnant after stopping birth control pills, and this medication should not be used during pregnancy. If you become pregnant or think you may be pregnant, it's important to tell your doctor right away. Additionally, this medication may decrease breast milk production, so be sure to consult your doctor before breastfeeding. It's important to be aware that certain medications and herbal products can interact with Norethin-Eth Estra-Ferrous FUM, affecting how it works or increasing the risk of serious side effects. It's best to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication without consulting your doctor first. Some products that may interact with Norethin-Eth Estra-Ferrous FUM include certain medications used to treat chronic hepatitis C, aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, and tranexamic acid. There are also some drugs that can reduce the effectiveness of hormonal birth control, potentially leading to pregnancy. These drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. It's important to inform your doctor when starting any new medication and discuss the need for additional reliable birth control. Additionally, Norethin-Eth Estra-Ferrous FUM may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking this medication. If you or someone you know has taken too much Norethin-Eth Estra-Ferrous FUM and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's crucial to get help right away in these situations. It's important not to share this medication with others. When taking Norethin-Eth Estra-Ferrous FUM, it's important to have regular complete physical exams, including lab and/or medical tests such as blood pressure checks, breast exams, pelvic exams, and pap smears. Be sure to follow your doctor's instructions for examining your breasts and report any lumps right away. It's important to keep all medical and lab appointments and consult your doctor for more details. As for the daily dosage, it's best to follow your doctor's instructions on when and how to take this medication. Typically, it's best to take it at the same time every day to help you remember. This medication is usually taken for 28 days in a row, followed by a 7-day break before starting the next pack. It's best to take it with food to help prevent stomach upset. Remember to talk to your doctor if you have any concerns or questions about taking Norethin-Eth Estra-Ferrous FUM. If you miss a dose of Norethin-Eth Estra-Ferrous FUM, refer to the product package for instructions on what to do. It's important to use backup birth control, like condoms or spermicide, to prevent pregnancy if you miss a dose. If you have trouble remembering to take your pills as directed, it's a good idea to talk to your doctor about possibly switching to a different form of birth control. Always consult your doctor or pharmacist if you have any questions about your medication. It's important to store Norethin-Eth Estra-Ferrous FUM at room temperature, away from light and moisture. Be sure to keep it in a safe place, away from children and pets. When it's expired or no longer needed, make sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.